Did you know that approximately 9% of women will experience a major depressive episode between the time that a child is conceived and the child's birth? In the following 12 months after a child is born, almost 7% of women will experience postpartum depression. Childbirth is a demanding and tiring experience. During pregnancy, a woman undergoes several hormonal, physical, emotional, and psychological changes. Additionally, massive changes take place in the mother's familial and interpersonal surroundings. A mother's emotions after childbirth might range from delight and pleasure to sadness and crying outbursts. These feelings of sadness and tearfulness are known as baby blues, and they usually subside within the first 2 weeks after delivery. While most women recover quickly from the baby blues, postpartum depression may persist much longer and has a significant impact on women's capacity to return to regular day-to-day functioning. Postpartum depression impacts the mother and her bond with her child. According to research, as many as half of postpartum depression in new mothers goes undiagnosed because of issues with privacy and not wanting to disclose to close family members. There's also a stigma around new mothers in that disclosure may lead to abandonment and a lack of support. Postpartum depression is diagnosed when at least 5 depressive symptoms are present on most days, and for the majority of the day for at least 2 weeks, beginning during pregnancy or within the 4 weeks following delivery. It involves either depressed mood or loss of interest or pleasure in most activities, along with symptoms that may include insomnia or sleeping too much, low energy or fatigue, slower body movements or feeling restless, feelings of worthlessness or guilt, suicidal ideation or attempt, or recurrent thoughts of death, impaired concentration or difficulty making decisions, significant change in appetite and weight. If you think these symptoms relate to your experience and are causing impairment in functioning in some area of your life, then please seek out an opinion from a mental health professional. How does postpartum depression develop? Research has indicated a variety of risk factors that may contribute to postpartum depression, including history of depression. Research has suggested that if mothers have a history of depressive symptoms during their lifetime, this can put them at a higher risk for depression during a pregnancy. In fact, research has suggested that mothers with a history of depression may be between 30% and 280% higher risk of developing postpartum depression. Speaking a foreign language. When a mother's primary language is not the same as the majority language of their community, this can weaken their connection with others and lead to feelings of isolation. This in turn can then have a negative impact on their mood. Single mothers. Mothers who do not have a partner or lack support from family and friends have to manage the burden of doing everything all on their own. When the responsibilities to care for a newborn rest solely on the mother and there's no one else to provide assistance, this can increase the level of stress and contribute to symptoms of depression. Additionally, mothers who lack confidence in their abilities to be a nurturing parent are at higher risk for postpartum depression. Lifestyle. As consistently getting a full night's rest as a new mother may not be realistic, sleep deprivation has been linked to postpartum depression. Additionally, the mother's overall health contributes to symptoms of postpartum depression, such as if they experience physical complications afterwards. Mothers who smoked prior to the birth of their child were almost twice as likely to experience postpartum depression. However, these symptoms are reduced by increasing physical activity and exercise, while a healthy and nutritious diet reduced postpartum depression by up to 50%. A baby is something you carry inside you for 9 months, in your arms for 3 years, and in your heart until the day you die. To learn about the 4 main parenting styles and how you can prevent your child from misbehaving during their upbringing, check out this video over here. Thanks for watching, and see you next time.